Hello guys, brace yourselves. Mahaba-habang topic to on oral microbiology. Samahan niyo ako, okay? Kayang-kaya natin to. So what we're going to learn today are your oral microbiome. Ibig sabihin, the different microorganisms that dwell in your oral cavity. However, we're going to focus on bacteria, okay? And guys, naturally, even though we don't have disease, there are bacteria in your mouth, and they are very important. Okay, some they just stay there. They are commensals, and they have their own functions. Okay, so they balance the different. There are different relationships when it comes to the different bacteria and microorganisms in our mouth. So other name for microbiome is microflora. Yan. So kikilalanin natin sila ngayon. What are the factors that affect the growth of this microorganism? So changes in these factors could lead to disease. Changes in these factors could lead to health and common microorganisms in the oral cavity. So we'll focus on bacteria. Okay. So general health, guys, is very much connected to your oral health. Alam ko, alam nyo na yun, okay? Hindi ba na isang masakit lang ng ngipin that it could affect your well-being. Yan. And maintaining a healthy mouth is important for your personal self-esteem and general well-being. So being healthy na different systems, respiratory system, vascular system, endocrine system, all of these are important because and also your oral health, okay? And oral disease can impact and could impact the overall health of an individual. Hindi ba sipon nga lang it affects your well-being, paano pa kaya ang sakit ng ngipin? And self-esteem, di ba? Ako back then, guys, nang hindi pa ako nagpapa-braces, talagang sungki yung ngipin ko, and I was not smiling. I'm not a smiling person before braces. So severe periodontal diseases, so periodontal, so infections of the gums and the bones. So nagsimula lang sa ngipin. However, the infection migrated to the gums, the surrounding gums, and up to the bone around the teeth. Might be a risk factor for low birth weights. So it could impact pregnant women. Tapos yung iluluwal nilang sanggol mababa yung timbang. Ischemic heart disease. So lack of oxygen, pulmonary disease, and ischemic heart, a tissue. A tissue in your heart. A tissue in your heart loses oxygen. Yan, ischemic heart disease, pulmonary disease, and diabetes mellitus or DM. It can serve as a portal of entry of pathogens. So guys, if there is an infection in your mouth, that you are more prone to bacteria or other pathogens entering your mouth. Kasi one of the barriers that stops the infection is your tonsils. And so if there is infection, it could be a open gate para makapasok yung mga infection. So how does your periodontal disease? So it's the disease that affects your bone up to your gums. So nagsimula sa healthy tooth and gum tissue until there is gingivitis. There is buildup of plaque and the inflammation of your gums and bleeding up to periodontitis. Yan. So plaque hardens into a calculus, so tumitigas. Pockets form around the teeth and bone loss begins. Yan. Then there is bone loss and significant swelling that's happening. Yan. So, yung periodontal diseases, pwedeng yung mga infection, yung bacterial infection, pwedeng kumalat sa blood system. So oral microbiome or microflora, guys, is a diverse microbial community. So it's a community, guys. Dito, it's a community. It's you cannot see. So they are grouped. They are in a community. So oral cavity is rich with microorganisms. Sabi, 1 ml of saliva has 10 raised to 8, 80 microbial cells. A typical healthy microbiome in a person comprised a range of 100 to 200 distinct bacterial microorganisms. So, ang rami. At so today guys, patikim lang yung mga i-share kong bacterial organisms. So, oral microbiome can alter the balance between health and disease. So guys, your community guys changes, okay? Depending on the status of the host, okay? So within the oral cavity, there are bacteria, archaea, paki-search anong archaea, fungi, protozoa, viruses may be all found having a particular role. Okay, so some are commensal, ayan. Some are only found when there is disease. They interact with each other. They have a relationship with each other, and guys, they could be competitive with each other. Yung iba, parang chill lang sila. Yung iba, very competitive. Yan. So, a harmonious relationship should occur between the host and the microbe. A breakdown of this relationship can lead to diseases. So, there are many factors wherein your oral microflora could cause disease. Yan. Example, if the person is not having a good oral health hygiene, di sure, di ba? The microorganisms will proliferate. Frequent eating of fermentable carbohydrates, sugars, yan, sucrose, and antibiotic treatment. So, kung nag-antibiotic si human, so depending on what the antibiotic is specific, for example, gram-positive bacteria, gram-negative bacteria, so not only the harmful bacteria will die, but also the helpful. So, depende kung anong ina-attack nung antibiotic, okay? So, good and bad bacteria could die in cases of antibiotic treatment. Okay, so, ang pangit sa antibiotic, guys. So, pati yung mga normal flora, yung mga good bacteria namamatay. So, excessive antibiotic treatment could be harmful for a person. Okay. What else? Alterations in the integrity of the host defenses following the drug therapy. Yan. So, pwedeng the host defenses became weak or because of drug therapy, or the person became stronger. So example, chemotherapy, talagang manghihina yung mga pasyente, no. So it could increase the chance of bacteria to proliferate. The presence of microorganisms at sites not normally accessible to them. So example, yung oral bacteria, dapat guys, nasa oral cavity lang sila. So pag nasa oral cavity lang sila, they won't cause disease. But guys, when there is tooth extraction or other traumas, and that oral bacteria could reach your bloodstream, di ba? It could affect the other organs, or it could cause septicemia, ganyan. So, yun. So, normally, dapat itong mga microorganisms, nasa oral area lang sila. But because of trauma or periodontal disease, yung malala na talaga, pumunta yung bacteria sa bloodstream. Yan. So, it could be harmful. Okay? So guys, this is just an overview kung ano yung mga bacteria present in a certain area. So in an area where it's exposed with oxygen, so most probably talagang mga obligate aerobes or facultative aerobes yung mga nasa top of the tongue, yan. However, pag nasa ilalim na ng gums, pwedeng mga anaerobes. Yan. Those who do not like bacteria, who do not like oxygen. Example to, Capnocytophaga sa sublingual plaque. So around the subgingival area. So because it loves carbon dioxide. So notice, puro Streptococcus yung mga nasa taas. So there are many Streptococcus groups in our oral cavity. So, ano pong mababasa niyo yan? Veillonella, yan, discuss natin. Prevotella, actinomyces, Fusobacterium. We will discuss those bacteria today. So, notice here, rin, marami, no? Hindi ko naman papamemorize sa inyo. Just to get to know them. So, the legend is blue. The blue one, the names which are in blue are increase in those types of diseases, and red is decrease. Yan. So, itong Porphyromonas gingivalis. So, kung may cardiovascular disease, mataas ang Porphyromonas sa mouth. Yan. So, Alzheimer's, Porphyromonas rin, and spirochetes. Yan. So, esophageal cancer, Porphyromonas rin, and Tannerella. Decrease naman ang Neisseria. Yan. In periodontitis, yan. So, Porphyromonas gingivalis, mataas. Treponema denticola, Tannerella, and archaeal methanogens. Marami yun. Caries. So, caries, guys, single R lang ha. Streptococcus mutans, Lactobacillus ang marami. So, guys, the bacteria concentration changes in different diseases. Galing, no? So, factors affecting the growth of microorganisms, temperature, redox potential. So, redox, ano bang isabihin? Reduction and oxidation, pH, nutrients, and host defenses. So, these are just few factors, diba? Wala pang nga ditong oral health, ay oral hygiene. So, first is temperature. Yan. So, this looks like a healthy gum tissue, healthy periodontal ligament, healthy bone. Okay? But in cases of disease, yan. So, the gum tissue recedes. Yan. Umikle. Tapos, it's inflamed. There is bone loss. So, at normal temperature, 35 to 36, yan, it's stable for microorganisms. However, guys, 39 degrees Celsius, yun, there is fever already. So, perhaps this fever was caused by an infection. So, example is, there is periodontitis na. So, the periodontal pockets is inflamed in active diseases. Yan, itong mga periodontal pockets. Yan. And what happens? So, temperature-wise, guys, I think the bacteria does not do well in high temperature, okay? Especially pathogenic microorganisms. They love body temperature, normal body temperature, which is 37. And so, if there is infection, usually the body has higher temperature, kaya nga tayo nag-fever, di ba? Small rises in temperature can significantly alter their gene expression. So there are changes in the creations of their protein. Kasi nga, yung gene will result to protein. And possibly competitiveness of individual species. So perhaps since the temperature is rising, they want to acquire more nutrition. So nag-aagawan na sila ng nutrients, ng food. So a rise in temperature could downregulate. So pinapabagal niya ang expression ng major proteases. So these proteases, guys, this breakdown, itong proteases, sinisira niya yung mga antibodies ng katawan natin. So kung nabawasan yung major proteases, it's a win for us, okay? And protein fimbriae. So fimbriae is for communication, hair-like structure. So good win sa atin talaga. Pag tumataas ang temperature, what else? Upregulate the synthesis of superoxide dismutase, which is involved in the neutralization of toxic oxygen metabolites. Yan. So, this superoxide dismutase, yan. So, nag-i-increase yung production niya. Okay. So, it's for neutralization of toxic oxygen metabolites. So, this is a win for the group of bacteria. Okay. Because this could protect them. So, next, guys, we have redox potential or anaerobiosis. So, guys, oxygen environment could dictate the amount of could impact the growth of your microorganism. Example, if the environment is oxidized, meaning there is many oxygen. So sa chemistry, we are losing electrons. This is good for aerobes. Yan, kasi they love oxygen, di ba? However, bad for anaerobes. Reduce environment wherein there is loss of oxygen or gaining electrons. These are good for anaerobes. Okay? So, oxidation and reduction in the oral cavity governs the survival and growth of the bacteria with different oxygen requirements. So pag oxidized environment, the aerobes love it, but the anaerobes hate it, and so on. Sabi niya, during bacterial growth, redox potential decreases. Yan. So kung maraming, tingnan natin, redox potential of the gingival crevice is normally 70 millivolts. Yan. Positive. Pero if there is growth in the growth of microorganisms and there is inflammation, negative millivolts, yung negative 50 millivolts yung redox potential. So normally, guys, so positive millivolts ang healthy individual and negative millivolts ang if there is periodontal disease. Yeah, negative. So it falls in the cases of plaque development. Okay? So negative pag may plaque. Okay. So next, guys. So pH, dapat normally our mouth maintains a normal pH because of your saliva. So the pH of an unstimulated whole saliva, so there's no food contact, so it's fairly neutral, 6.75 to 7.25. Neutral rin, pH of the palate. And neutral, malapit ng tongue, flora of the mouth, and buccal mucosa. However, guys, after sugar consumption, the pH fall. Okay, biglang nagiging acidic ang bibig kasi of the production of acids. Why? Because your bacteria utilizes your sugars and converts it into acids. Hence, the fall of pH. Yan. Depending, parang lapit ko na pala sa camera. Depending on the frequency of sugar intake, bacteria and plaque will be exposed to varying changes of low pH. Okay? So if you love sugar, yan, if you love sucroses, and you're not brushing your teeth, you're di ka man lang nagmumumog and it stays in your teeth, those sugar plus bacteria plus time will convert the sugar into acid. Yan. And this acid will break down the enamel of your teeth or demineralize it. Yan. So the pH of gingival crevice can become alkaline during host inflammatory response in periodontal disease. So kung lumaban na yung katawan, like yung mga WBCs natin, white blood cells natin, the pH could return back to neutral or maging alkaline pa nga. So what else? Nutrients. Yan. So basically, sugary foods for us is not good for the teeth, okay? Kasi nga nagiging acids. Dairy products, however, are good because it neutralizes the acid. It could protect the teeth from caries due to the buffering capacity of milk proteins. Yan. It could neutralize the pH. Yan. So milk tea, ma'am, kasi may dairy, may sugar. Yan, mag-brush ng ngipin. So acid, if we have an acid-producing bacteria, example, Lactobacillus, Streptococcus mutans, and it is exposed to a sugar, it will produce acids, okay? And it will lower the pH. Yan. Inhibition of beneficial bacteria, overgrowth of cariogenic bacteria which promotes the formation of dental caries. It will demineralize your teeth and will produce dental caries. However, meron tayong mga base-producing bacteria, si Streptococcus sanguis and oralis. So it will reduce a neutral pH, remineralization, and health. Oh, okay. Next, guys, is nitrite in vegetables. So, nitrite, if there is a bacteria naman, it will be nitrate will be converted to nitrite. Yan. At low pH, this nitrite can be inhibitory for the growth of the bacteria. Okay, so the nitrate in vegetables could be converted by the bacteria into nitrite, and this nitrite is not a good metabolic for bacteria. Ayaw nila to. Xylitol. So xylitol is a sugar substitute. So it's not made of sugar. And so it's not being converted. So since hindi siya sucrose, hindi siya maka-convert into acid. Yeah, by the acid producing bacteria. So okay ang xylitol. If you really have craving for sugar. Ayan. So, yung mga aspartame, ito amino acid yun. Ito guys, host defenses. Of course, if you have strong immune system, is you can fight off bacterial pathogens. Okay? So, actually, in your immune system, we have two. We have two. Okay, lahat tayo. So, we have innate immunity. These are non-specific. Example, anatomical barriers. Example, guys, your skin. This is one big anatomical barrier. So this skin protects your vital organs from the harmful environment. Chemical barriers. Yan, marami tayong chemical barriers na pag-uusapan, and cellular barriers, your white blood cells. And we have adaptive immunity. These are very specific. And the main actor in an adaptive immunity are your antibodies, and your plasma cells are the one that produces antibodies. And so you could get antibodies when you have disease naturally. So kunyari kung may COVID ka, pumasok yung COVID virus dito, your body will create antibodies for you. However, there is also vaccination, okay, wherein the vaccines will probe the body to create antibodies against the COVID-19 virus. So your innate immunity is also called as natural immunity. Your adaptive immunity is also called as acquired immunity. Yan. So natural immunity siya, it's non-specific pero. So it just keeps So it keeps attacking on the pathogen, on the foreign body. It's non-specific. However, itong adaptive, it's very specific. So if you have produced antibodies as for COVID-19 virus, those antibodies will only be for COVID-19 virus. It's highly specific. So if a tetanus toxin enter your body, your COVID-19 antibodies cannot attack your tetanus toxin, okay? Unless you have a tetanus vaccine. Yan. So, kunyari, kinagat ka ng aso, may rabies yung aso, so get a rabies vaccine. So, actually, they are initiating adaptive immunity kasi nga antibodies ang involved. So, your innate immunity is always present in the body. So, adaptive immunity is generated in response to an exposure. So, unless nagkaroon ka ng sakit, so the antibodies are only produced once you would acquire that disease, okay? Or you had vaccines. Example of natural immunity, plasma proteins, phagocytes, your WBCs, physical and chemical barriers. Humoral antibodies yun, and cell-mediated immunity are the components of adaptive immunity. Ito pa yung gusto ko. Sa adaptive immunity class, there is a creation of memory cells. Pwedeng tandaan ng katawan. Ang galing, no? So, kunyari, may na-meet na siyang infection, example, dengue. So your body will create memory cells so that it will always remember that you had dengue before. Galing, no? However, yung innate immunity, walang ganun. Kasi nga, it's very non-specific. It's less potent. And so on. Galing, no? Yan. So, host defenses class. Yan, raw spelling tong defenses ko. Example ng innate o non-specific, yung pH changes in the body, saliva. Yan, it maintains a neutral pH. So, mucin in saliva, it lubricates it. Class, the lubrication is a way of protecting your mouth, okay? So, people who does not have a saliva is more prone to infection. Guys, nung I was operated for my thyroid back in 2015, I was under general anesthesia, tapos bibigyan ka ng oxygen, guys. Ang effect sa akin ng oxygen, nag-dry yung mouth ko. And after the surgery, ang rami kong tawag doon, mouth ulcers. Ang raming singaw. Because nagkaroon ng infection yung bibig ko, yung mucous membranes. Since my saliva dried out. Tapos yun, yung mga bacteria, yan, they made singaw in my mouth. So mucin in saliva lubricates, agglutinate the oral bacteria and interact with exogenous pathogens as well as virus. So it could agglutinate the microorganisms in your mouth. Yan. Pagkukumpul-kumpulin niya. We also have lysozymes. So these are now chemical barriers. So lysozymes are found in your saliva, in your tears. Yan. So this is antimicrobial, okay? They could lyse bacteria or kill bacteria by hydrolyzing the peptidoglycan by destroying the cell wall. Yan. And meron pa. Chitinase destroys the cell wall of yeast cells. Lactoferrin, it steals the iron from your bacteria. Ang bacteria, guys, gumagamit ng iron for their growth. So, lactoferrin could steal, nakawin yung iron para hindi na mag-grow yung bacteria. We have sialoperoxidase. Yan. So, sialoperoxidase can generate, could turn into hypothiocyanate, which could inhibit glycolysis. Yan. So glycolysis is the utilization of sugars for energy ng bacteria. So kung inhibit mo, hindi na siya magkakaroon ng energy source. We have histatins. So antimicrobial and antifungal play a role in wound closure. So if there are lesions in your mouth, it could heal it. Defensins. So antimicrobial through direct membrane disruption. So it destroys the membrane of the bacteria and the cell wall and neutralize the toxins. It makes it ineffective. So ang raming use ng defensin. Host defenses. So the main antibodies that are found in your oral area is your IgA. So ang IgA, nahanap yun sa secretions, sa laway, sa luha, guys. So IgA are produced by your plasma cells, okay? So your plasma cells are differentiated or cloned, kumbaga, activated B cell. Yan. B cell is a type of lymphocyte. So itong B cell na to, na-activate siya, naging plasma cell. And this plasma cell has the capacity to produce antibodies, which is specifically IgA, okay? So, itong B cell, pwede rin siyang maging memory cell so that it will have a memory of the disease. Okay? Na-meet na kita because I have a memory cell. Okay? So, let's meet now the common microorganisms in the oral cavity. So, the most abundant one is your Streptococcus mutans, which is part of the mutants group. So, Streptococcus, hindi ba pag sinabing strep, it's in chains, coccus, round. So, it's a gram-positive cocci. Okay? That's why purple yung gram staining niya. So, it's common in oral cavities. It's present from birth because of the kissing of mothers. Yan, doon nalilipat. So, guys, alam nyo ba yung mga newborn baby, hindi ba, ilalagay sila sa skin ng mom. So that the normal flora, normal bacterial community of the mom could transfer on the skin of the baby. Yan. So actually, ginagawa talaga yun. It's mandatory na mag-share ng normal flora. Kaya ipapastay yung baby sa dibdib ng mom. So major bacterial component of dental plaque is your Streptococcus mutans. It could adhere to the surfaces of the teeth of the plaque through its dextran-based polysaccharide. So it could produce lactic acid. Yan. If it eats your sucrose. Yan. And dental cavities could lead to gingivitis, abscesses, and periodontal disease. Other Streptococcus under mutants group is Sobrinos and Crissetti. So let's get to know your dental caries. So this is from a 10-year-old. So siguro talaga nagsimula sa healthy tooth hanggang nagkaroon ng caries. Yan, or deep or a cavity. Yan. So it's caused by the bacteria. Tapos nagkaroon ng plaque. Tapos ng low pH. Tapos the teeth was demineralized and the formation of caries, single R. Yan. So caused by your Streptococcus mutans, Sabrinus, and Lactobacillus species. Yan. So risk factors who are more prone to having dental caries. So prolonged bottle use. Yan. So matagal yung mga bata na may milk teeth, ang tagal-tagal na gumagamit ng bottle, poor oral hygiene, eating sugary foods, diabetes mellitus, salivary gland disorders, examples, Sjogren's. So itong Sjogren's syndrome, talagang walang laway. Yan. So they are more prone to infection, decrease salivation, and medication that decreases salivation. So nababawasan na rin guys ang bad breath dahil sa laway. Okay. So here, this is an orthopantomograph of the teeth which has dental caries. Yan, nagli-light up because it is radiolucent areas. Yan. So may radio label for it to light up. Yan. So hematogenous spread of bacteria to heart valves. Yan. Sa puso, sa joint, sa prosthetics. It could lead to the bone abscesses, soft tissue infections in the extraoral perforation, deep head and neck infection, jaw osteomyelitis, yan, infection of the jawbone, and tooth loss. So other guys, Streptococcus, we have anginosus. So it is also found in dental plaque and mucosal surfaces. So notice here guys, the maxillary, yan, is inflamed. Yan. So yun, salivarius, isolated from the mouth. It could colonize the mucosal surface and the tongue. So vestibularis, it's found in the vestibular mucosa. So vestibular mucosa, this one. Yan. Streptococcus mitis, yan. Also a common normal flora in the oral cavity. Streptococcus parasanguinis. So not only the mouth, but you could find it in your throat, in your blood, in your urine. And Streptococcus pneumoniae, because the mouth is the entry point of Streptococcus pneumoniae, it could be found in your nasopharynx. Yan. Left side, mitis. And right side, pneumoniae, susceptible to Optocin. So Optocin, guys, is an antibiotic. So pag pneumonia, napapatay ng Optocin. Yung mitis, guys, hindi napapatay ng Optocin. So careful utilization of antibiotics is needed. Kailangan malaman mo ano ba yung gumaganang antibiotic para sa bacteria. So other gram-positive cocci, we have Granulisatella adjacens, and Abiotrophia defectiva. So ang dating pangalan class ni Granulisatella is nutritionally variant streptococci because streptococci siya in Morphology. So in chains tapos pabilog. Okay? It's found in the mouth and the tooth surfaces. Gram-positive rods, so bacilli itong mga to, it's found in the gingival crevice. And we have radicidentис, Naslundii, and Israelii. Israeli, Naslundii. So, bala kayo dyan. Yan. Basta, Israeli. Can act as an opportunistic pathogen. So, I want you to Google what's opportunistic pathogen. Causes chronic inflammatory condition. Yan. So, guys, go over this. Okay? Tapos, guys, itong actinomyces, these are rods. Yan. Gram-positive rods, and it's found in the gingival crevices here. Gram-positive rods pa rin, we have Lactobacillus. Yan. So, they could cause dental caries as well. Kasi nga, they convert the sugar into acids. We have Pseudoramibacter, Alactolyticus, and Slactia exigua, found in root canals. Yan. So, yung binutas, yung sinira, yung dine-activate siguro na root canal, yan, ang makikita doon, itong mga bacterium to, and Bacterium. Gram-negative cocci, so pink sila. So, itong Neisseria at Moraxella, usually they come in pairs, and they are spherical, yan, in pairs. So, early colonizers of the teeth ang Neisseria, they are obligate. They are creating conditions that permit obligate anaerobe to grow. Okay, so, ito ba sila obligate anaerobe? Same thing with your Neisseria, guys. Moraxella comes in pairs. Gram-negative rin, so pink. So here, gram-negative cocci, we have Baylanella. Yan. So it could cause tooth decay cases. And rugose is found in caries-free, in the dental caries-free individual. So single oral caries, sorry. So parahemolyticus, isolated infections of the oral cavity, but is probably not a regular member of the oral microflora. Okay. Facultative anaerobe sila. So it does not like, it just likes minimal amount of oxygen. So obligately anaerobe. So ito ng class mga anaerobe, they live under the gums yan, or anything any place that is hidden from oxygen. So dito under the cheeks, pwede. So Prevotella, they are saccharolytic, so they could also produce acid from sugar. Yan, acetic, succinic, and other acids. Majority of this can be isolated from dental plaque. Prevotella intermedia, okay, sa abscesses. Porphyromonas. Yan. So it causes periodontitis. It's a saccharolytic. So it does not convert your sugars into acid. Wala silang pakialam sa sugars. They focus more on proteins and peptides. So guys, peptides are the bonds that connect your amino acids together. So Porphyromonas gingivalis, they're found in subgingival sites, so below the gums. Recovered from tongue and tonsils. Endodontalis, recovered as well in root canals, and Cattonia in shallow pockets. So they do not like oxygen na. And I think this is the last. Fusobacterium, same thing, it's a saccharolytic. So it does not convert your sugar into acids. Okay? We have nucleatum. It is found in periodontal plaque. Yan. It could coaggregate. Yan. It could form a community with your Porphyromonas gingivalis. Your polymorphum is isolated from the normal gingival crevice, isolated from periodontal disease, itong periodonticum. So this is a rod in shape. Yan, bacilli siya. Yan, guys. So that's the end of our oral microbiology. So study well, guys. Bye-bye.